Hi guys, welcome back to episode 2 of Life Unfiltered. I'm Caitlin.
And I'm Emily. And today we get to talk about Caitlin and her experience through just experiencing a loss almost through social media, like talking about a loss through social media and kind of what her and Kanan's experience was with um, their miscarriage. And thankfully now they have a little baby girl. So we're going to get into it. Um, So, Caitlin, you were diagnosed with PCOS at 15. What was that? What was that conversation like at the age of 15?
So it actually was, I woke up in the middle of the night. I vividly remember it. My bedroom was below my parents' room, thank goodness. I woke up in the middle of the night just excruciating pain, and I didn't know what was happening. I mean, at 15, and all of a sudden your insides feel like they're being ripped apart. Like, I was terrified. And so I remember yelling for my mom because I didn't have my phone. I'm pretty sure I charged my phone in upstairs or something. And she came downstairs and she was like, "What's going on?" And I was explaining it to her, but it was almost like I was short of breath. And so she was like, "We need to go to the hospital. Like, something's happening and I don't know what it is. Like, I can't fix this." So I went to the hospital, and they ran a whole bunch of tests. They work you up and down.
Right.
They couldn't find anything. Nothing was wrong. White count's fine. Everything came back, and they were like, "We don't know what's happening. Like, it's not a kidney stone. Like, we're not sure." And so they did an ultrasound. And that's where they discovered I had a cyst on my left ovary that had ruptured, and it was a fairly large cyst. And they were like, "This is causing all of this pain." And so then the doctors were explaining to me, like, this is a symptom of PCOS, which is polycystic ovarian syndrome. And PCOS is a very wide range of things. Like, you could have it and it can never affect you, or you could have it and it could hinder your ability to even have children. And so they said, this is kind of the first couple times that you've had a cyst. It looks like we see some scar tissue, so it might hinder, or it may just give you a couple hurdles to jump through when you decide to have children later on. So that was a lot to process at 15, and I didn't fully understand what that meant until I was an adult.
Right. So then you guys, you got married to Kanan, and obviously at that point, you guys start talking about family at some point, and I'm sure uh, your 15-year-old self, as you're talking, as you're thinking about it, is like, well, this is like a thing that happened to me at 15 that I'm aware of. What did that conversation look like with Kanan?
So I had never really gotten a full picture of how it was going to affect me. Nobody ever really looked into it after that. Like, they just said, it's going to happen, and you won't really discover how difficult it's going to be for you to get pregnant until you start, until
So
you
you
try.
don't really you didn't at that point know on the scale like where you were. You just knew that like
Mhm.
you were affected by
I
it.
just knew I had cysts on my ovaries. I knew that they were rupturing and it was painful, and I knew that I had some scar tissue. That's
Yeah.
all. That's the gist of the picture that they gave me. And so I was like very lost with what to do with that information, because it was valuable information. It was good information to have, but it really wasn't enough to make any sort of judgment moving forward on my ability to have kids. So when Kanan and I talked about, hey, we'd love to start a family, we'd love to start trying, this is something we really want to do. My OB at the time was like, just rip the Band-Aid off and just start trying, and we'll see what happens. Because I was told, through that OB, I later changed OBs, but through that OB, she wouldn't test me or do any further testing until I had tried for at least a year. And if I still hadn't become pregnant within a year, then she would look into it. So.
Okay. So you guys just didn't know. When you guys kind of started family, you guys just kind of had the conversation of we're going to try and see what happens and
Yeah.
get support if need be, but
Yeah. And so Kanan and I, originally we were like, let's start trying in 2020. And then the global pandemic hit, and we were like, time out. Like, maybe we don't bring a baby into the world during this crazy time in everybody's life, because
Yeah.
hospital restrictions were insane. And so we were like, we just don't really want to mess with it. Let's wait. And then Kane ended up getting deployed for 2021. And so we were like, okay, once he's back, that's when we'll start trying, and we'll see kind of where that takes us. And it took us only 2 months the first time to get pregnant.
And when was that? That was
So we got pregnant the first time, February of 22.
okay.
And we were pumped. I had bought actually a shirt while he was deployed because I was like, I really want him to get pregnant. Or I really want to get pregnant, but I really want him to be surprised. And so I was like, I have to buy something while he's gone and then hide it, because even if I Amazon it, like, I'm going to sit here for 2 days with this secret and I'm not going to be able to hold it. So I pre-planned, bought this little t-shirt while he was deployed. I found out that morning he came home after work. I went to work. Everything was normal for the day. I put everything out. I put pregnancy test and the shirt on the bed, so that way when he came home, he'd find it. And he was more just in shock because, like I said, we didn't know if we were going to be able to get pregnant. We didn't know. It was just kind of up in the air.
And it had only been 2 months, right?
Yeah, and so we were shocked, absolutely just dumbfounded that it took us only 2 months, because we were under the impression it wouldn't, it would take a while. And so we started telling, all of our family and friends pretty soon after. I would say probably around the 6-week mark, I was starting to tell all of my family and my friends. We flew down to Florida and told his family. We told my family at Easter. And so everybody knew very early on in that pregnancy. And so then I went to social. I was super pumped. we're having
as you are when you find out that you're pregnant.
Right? And so I found a cute, adorable picture. I edited it. I, made it about us and our baby and all this. I was due in November. And so I was pumped. And so we announced on social media, on Facebook and Instagram, on both of our personal pages, that I was pregnant when I was only 8 weeks.
Oh, why did you guys do that?
I was just excited. And, to me, you got to celebrate even the littlest of things. And having a baby isn't a little thing. But to me, also getting pregnant was a really big thing, because I didn't know if I could. I didn't know what that would look like. And so I wanted to celebrate and be proud of the fact that we were having a baby.
Yeah.
It's fun. Yeah. And so, I just did a full send at 8 weeks and posted everything, and it was exciting, and we were pumped. And, so many people reached out to us and called us, and it was just, you're on cloud 9, when something this big happens in your life. And so it was just really cool to see so much support. And nobody knew that I had PCOS. That wasn't something that I really advertised or put out there. And so to see how much support we got from just being pregnant was just really cool, even though people didn't know our story. And so I was just really excited. But yeah. And then you don't have your first ultrasound typically until the end of the first trimester. And so we went in at 11 weeks. And so typically your first trimester, some doctors will say it's 12 weeks. Some doctors say it's 13 weeks. It's somewhere around there. My doctor at that time was like, sure, you can come in. We have this appointment or this opening for a sonographer. Come on in. And so we both took a day off, morning off of work, because being a teacher, you can only take AMs or PMs. So I had to take a full AM day. And we went to the doctor's office, and we're both, cloud 9, we get to see it, and it's going to be real and all of these things. And we go back, and there's this little room that they brought us in, and we're so pumped. And Kanan's sitting next to me, and there's this huge flat screen in front of us. And the sonographer goes to scan me and is on the baby, and I'm sitting there and I have no idea what I'm supposed to look at. Like,
Right.
I don't know. I've never done this. And she sits there and she sits there and waits a little bit, and I'm like, what's going on? And she's like, is this your first pregnancy? And I said, yeah. And then that's when all of a sudden I was like, I don't think that's a normal question. Like, that's when all of a sudden I was like, that's odd. And the sonographer goes, well, you don't have a heartbeat. And I just stood like, I don't know how to react, you know? And so she was like, yeah, the fetus has died. It's no longer a viable pregnancy. And
Wow.
I mean, you go from cloud nine to like, this is your worst fear. And Kanan and I didn't know what to do at that point. And like, what do you do? And that's when she had told us the baby had passed 2 weeks prior to that appointment. So the baby passed at 9 weeks, and we were there at the 11-week mark. And so we got dressed, and she was like, okay, we just need you to go into this room, and your PA will be in to talk to you. And so we were like, okay. Just, I mean, at that point, you go from cloud nine to like,
just a little bit of a survival mode.
Yeah,
because
because well, you don't know what to do. Like, you're like, okay, I've
Yeah.
never done this. What's next? What do I do? Like, what's gonna happen? And so we sat in this little room, and obviously we were getting ridiculously emotional at this point because, you know, we had just lost what we had wanted so badly.
Right.
And my PA comes in, and she's the sweetest human being ever. And she comes in and she goes, I just want to hug you. And so I was like, okay, I haven't talked about this in a while. And she was like, okay, you have options. Like, I can give you a pill, it'll help. You can wait until your body just, you know, realizes it's not a baby anymore and you can pass it on your own. She was like, or you can have surgery and it, like, we'll put you under and we'll remove it for you and like, and then it's done, which is called a DNC. She was like, she was like, do not make a decision right now. Think
I was
about
gonna
it.
say, what was that like thought process? Like, how much time did you guys get to kind of make that decision? Did you guys like, did you and Kanan get to go home and talk about it? Was it something that like they just told you call us back and let us know which option by this time?
Yeah.
Or
So she, once again, without her, I think this process would have been a lot harder. She was very patient. She was like, I can walk you through everything. I will give you details of every single scenario if that's what you want. And I said, yeah, I need that. Like, tell me exactly what's going to happen if I go with option A, B, or C. Like, give me the nitty gritty. And then she was like, well, do you want genetic testing? Like, do you want to find out why? And I said, I don't know. Should I? Like, I don't know. I've never been in this spot. And she goes, it's up to you. It's your decision. She was like, your OB prefers to have it just so that way for future pregnancies, she will know, you know, did this happen? Is there a medicine we could give for this? Is this the reason what's going on? So that way you can kind of pinpoint. And so I said, sure. Like, that's fine. Because, I mean, once again, you're in, like, I was numb at this point. Like, I was like, just tell me what to do. Just tell me what I need to do.
yeah.
And so she was like, okay, if you do that, if you do option A or B, which was the pill, or just wait until my body like naturally passes it, which essentially would be my body going into labor, I would labor at home. And she was like, and then you need to bring in the fetus so we can genetic test it. And I went, I can't do that. Like, I can't do that. Luckily my best friend is an OB, and so she was like, if that's the choice you would have made, like, I would have come over and like I would have taken care of that. Like, yeah. I would have not had you deal with any of it because she's had medical experience, because she knows what to do. And so I was like,
right.
Like, that was some reassurance. I later talked to her about it, but I ended up choosing the DNC because I didn't want any more trauma associated with it. And I felt as if I had a labor at home and passed this pregnancy with just me and Kanan, I think that would have scarred both of us to the point of we didn't know if we'd want to start trying again right away, if we would have waited years, if we wanted to have any more at all, you know? And so I was like,
Sure.
for my own mental health, for my own well-being, I need to not be involved as much
Yeah.
as it's part of my body. Does that make sense?
Yeah. So from the time that like they told you
Mm-hmm.
that, and you guys made the decision to the actual DNC, like how much time happened and like what was that? What did they do for the DNC? How did they prep you? What was that experience?
So I told her, we sat in the room for like 30, 45 minutes of her explaining. And at the end, I went, I just want the surgery because I was so traumatized by like the other two options. Now, not saying that people can't do that. I couldn't do that. That was not something I knew I was not strong enough to do.
Right.
So I chose the DNC while I was at the doctor's office, but she was like, you can wait, like you can, take as much time as you need. She was like, prefer within like a week or so. She was like, less than that ideally, because they just didn't know how long my body was going to take to realize. Because mind you, the fetus had been dead for 2 weeks and my body hadn't registered it. So they were like, you could go
Right.
into labor tomorrow to pass it. You could go into labor next week to pass it. Like they didn't know a timeline. And so I was like, I'll just do a DNC. Like I don't want to mess with anything. And so they got a DNC. And at this point, I requested my records to be sent to a different OB, only because the OB that I had, I just wasn't really connected with. Didn't really prefer her. Didn't feel comfortable going through this process with her. And so I switched OBs. And I loved my new OB. All of my stuff got sent to her, and she was like, cool, we'll do your DNC in 2 days. And I was like, awesome, because I don't want to wait and have my body go through this on its own.
Right.
Ended up being able to get my best friend on the case as well as the resident. And so I get to the hospital. It's an outpatient procedure. I went in. You get gowned and you sit in like a pre-op room for a while, and Kana was there. I got an IV in my hand. I had to sign off all the paperwork. But I'll never forget I don't know if she was a nurse or who she was, the young lady who came to get me, and I mean young, she was probably like 19, 20. And I'm 27 at the time. And she comes back, she's like, all right, you ready to get this over with? And I instantly just lost it. And I don't think, and that's why I don't know if she was an actual medical personnel or she was just somebody to transport patients.
Right.
Because I was like, if you knew what I was here for, those would not have been the words that you chose.
Right.
And so I remember I was so choked up and I was doing everything I could to be strong for Kanan because I knew he's still trying to process all of this. I'm still trying to process all of this. If I'm breaking down, like, it's going to be super hard for both of us. So I remember I was super choked up, and then she wheels me to the operating area, and luckily my best friend was there and was like, I'll take her. And that's when I was like, okay, I can lose it now. And so I fully cried. And that was hard. And so I go into this sterile room, wide awake, and I'm sitting there like, this is it. Like, that's it. Like, it's the end of my pregnancy. And, I don't know what the future looks like. It's so unknown,
Yeah.
So I get on the table, I get strapped down in like a T position, and I was they have me hooked up to the like blood pressure heart rate thing, and they were like, okay, we need you to take a couple breaths. And I was like, okay, I'm fine. Like, trying not to cry, but obviously they can tell, like, I'm super upset. And my best friend comes up to me, Peyton comes up to me, and she just grabs my hand, and she was like, I'm gonna be here. And she said that she was going to catch my baby.
Hmm.
I haven't talked about this since it happened. Um, and so they put me under, everything goes fine. They wake me up later on, tell Kaden everything's fine. They send me pain meds because they just induced my body into labor, had me
Right.
dilate, did the whole thing in roughly 30 minutes. And they were like, she's probably gonna be uncomfortable for a little while, at least a few days. And so we go home and I slept. And I guess I was still pretty loopy in the car. And Kanan will probably talk about this when we have him on here, but I sobbed the whole way home, and I apologized profusely for killing our baby, but it's not my fault. Like, I know that, but it's the guilt. And so I went home and recovered for, I don't know, 2 days. And then 2 weeks later, I went back to my OB, the new one that did the surgery, and she was like, everything looks great. We made sure your uterus looks really good. We took pictures, we checked out your ovaries. Like, she was like, we did a full workup on you when we were in there just to make sure everything's healthy. And then we talked about future steps after that. But I didn't really tell anybody I had a DNC. I didn't, nobody at this point knew I had miscarried. And so I was just kind of keeping it to myself for a little while. But
Right.
yeah, it was emotionally, it was a very hard process.
Well, what a blessing that you got to have your friend in the operating room with you. I mean, that's not a thing that
Yeah.
most women who go through that like can say, is
Yeah.
that like my friend was next to me in the operation room. Like,
Mm-hmm.
was that like, I mean, to me, it would have been, I mean, as hard as the situation was, like, that would have been comforting to me to know, like,
Yeah.
okay, like, my best friend has my hand, has like my best interest, knows what's going on, and can advocate
Mm-hmm.
um, as best as she can at the time for you.
Yeah.
So,
It
wow.
was, I'll say this, I had a phenomenal medical team that did the surgery. I loved my OB that I had. She was amazing. Um, and so being able to have my best friend in there and such a good medical team, I don't think I would have had such a good experience through it, because it is a
Right.
very just heartbreaking experience to, experience a loss and then have to go through that. And so it was a lot of comfort knowing that I had people that were there for me that truly wanted my best interest and truly just at the bottom of their hearts were like, this is awful. This sucks.
Yeah. Yeah.
So it was
Wow.
awesome. It was awesome to have them. Like, that was a huge blessing for me,
Yeah.
for sure.
So
But
as this happened, right, then, we kind of talked about how, I mean, when you go through grief, right, and when you're going through a loss, like, you want that time, like you had stated, you guys took a little bit of time, personal time to like
yeah.
digest it together as a couple. But, did you guys like, how did the telling people process kind of happen? Because like you had posted obviously at 8 weeks, but like that probably wasn't your first thought. Your first thought was, okay, like we need to tell our family and our close friends. So what was kind of the lead up of having, because I mean, I think women who experience that loss, like it would be hard to have to start processing, like, okay, how do I start
Mm-hmm.
letting people know that this happened? Like, what did that look like for you guys?
So the day that we miscarried, I sent out two different group texts. It was the same exact text message, but I just put two different group texts. Um, One was to my bosses, my principal and assistant principal at the time, and I said, "Hey, I'm not coming back to work." So the stuff that said this morning, can you just see if she'll stay? And like ask my para, who was phenomenal. Ask my para just to give her something because I'm not coming back. And they were like, oh my God, please don't come back to work. Please don't come back to work for like the rest of the week. I think this was like on a Wednesday. And I was like, cool. I'll see you Monday. Like, done. And then I sent out a group text to my family, and Kanan sent out a group text to his family saying that we had lost the pregnancy and that we just needed time. Because we didn't know what that grieving period would look like. And to grieve something that at that point is an idea. I mean, it's not an idea. It's an actual baby. Like, it's legitimate. But to me, I was like, oh, I'm pregnant. This is cool. Like, until I hit that sonogram, like, it didn't feel real to me, if that makes sense. And for everybody, it's totally different. Some people are like, oh, yeah, the moment I'm pregnant, it's like, this is the thing. And I was like, holy buckets. Like, I was told it'd be really hard to get pregnant. And so that's why I was like, oh, okay, this is kind of new. So we sent out text messages and we just asked for time and space. But we had posted on social media, and that was the part that we didn't know how to approach. And we were like, well, maybe if we just don't do anything, it'll die off.
Yeah, like you'll be able to maybe tell people individually, but like you won't have to like.
Yeah, like do something.
People will talk.
Yeah, people will be like, huh, she hasn't posted any pictures, she doesn't have a bump. You know, like I was like, maybe it'll just phase out. Fun fact, pregnancies don't phase out. People get really excited for them. Rightfully so. And so it wasn't until we went to a Dierks Bentley concert. I took you and your husband. We had a great time. But we were there, and it was, oh gosh, within the first, 10 minutes of us showing up.
Yes.
It was a bunch of our close family friends were there. It was a small private concert. So you knew basically almost everybody that was there.
Yeah, you knew like everybody. You were going like from person to person, just like.
Yeah. Well, and so that's why I was like, oh, I get to see, like, I'm going to go and be social. And for me, like, that's re-energizing when I get to be social. And so I needed that.
And in the comfort of your family. Like, you had your family there.
Yes, family and a ton of close friends. And it was one of my mom's, she's so sweet. She came up to me, and I don't remember if she touched me or not. That part, it doesn't stick. That detail doesn't stick. But she goes, oh my gosh, you are absolutely glowing with this pregnancy. And this was like 3-ish weeks after my D&C. And I just remember at first I didn't know what to do. Like, I don't know what to say. And so I just kind of paused for a minute. And then I think the next thing that came out was, I lost the pregnancy 3 weeks ago. And obviously she felt absolutely distraught for saying that. And I was like, no. Like, that's no fault to you. Like, you didn't know better. Like, how would you have known that I had gone through this? And then people at work had also been like, hey, how are you feeling? Like, are you sick? Like, are you feeling good? How's that first trimester treating you?
Mm-hmm.
And I think it was at that moment I went, I need to say something. Like, not like just a one-on-one conversation, but like on a social media platform. Like, I need to put it out there because I can't keep reliving this moment over and over again for the next X amount of months.
Well, and the hope would be that people would read it and then kind of stop asking and move on to a different topic when they see you. Because that's what people do. When you're pregnant, people just come up to you and they're like, how are you doing? And especially the first trimester, I mean, if they know, like, you're not showing at that point. So that's like, they have no idea.
And so that's why I was like, no fault to anybody who came up to me and was like asking me how I'm doing or any of that, because they didn't know better.
Right.
But every time somebody would ask me, it was just like another just knife to the gut. Like, it just hurt every time for me to say, like, I lost the pregnancy.
Yeah.
And so after that, Kane and I, it was mainly me. I sat down and was like, we have to post about this. We have to post that I'm not pregnant anymore because I can't keep reliving that moment. And so we found a really nice picture. We just did a short blurb of, we went in for a routine sonogram. Everything was fine up until this point of pregnancy, and we had found out we had lost it. And so I just said at this time, we just need time and just extra prayers, and we're going to get through this grieving process the best that we know how. And then we just asked for grace because, there were days that I was functioning at 10%, and there were days that I'd function at 90%. And so I was like, just give a little bit of grace, Yeah.
Yeah,
And
I kind of want to talk about that just like for a second,
yeah.
because you and I both kind of experienced that in different ways. Because I know I texted you. I mean, we'll get into mine like later, but
Mm-hmm.
I want to kind of talk about yours because I know for me, it was a moment, and I think women experience this, and I didn't realize this when either there's a loss or that kind of thing, and I think everybody experiences this, but we don't talk about it, that like there's days that it's okay to not be okay and to decide like I'm gonna be selfish in this moment and like
Mm-hmm.
take care of myself
Yeah.
and cry and be a little dramatic. And so like what was that kind of like for you? I know you had said kind of the concert was maybe one of those days that were a little overwhelming, but
Mm-hmm.
how did you feel like you dealt with that those days that you were only at 5 or 10%?
A lot of it was, I personally, I thrive off of being surrounded by people. I'm very much
Mm.
a people person. Where it's funny, my husband is not. Like when we go to social events, his battery drains and it recharges mine. And so I found when I was at next to nothing, it's not that I wanted to go and be social with somebody, but I just wanted to spend time with somebody. And so a lot of times, like Kanan and I would just spend time together. We tried to do like go out to dinners or, do something that was out of the house, try to get out, try to have some sort of normalcy in our life. But a lot of it I found leaning on a lot of my friends, and
Mm.
leaning on a lot of my family. And after making that social media post of like, hey, we've lost this pregnancy, the astronomical numbers of people that came forward and were like, hey, I've also lost a pregnancy. Hey, I've lost X amount of pregnancies. Hey, I've been there. And so my phone was blowing up, not just because I had lost. Like, I had people that were like, I'm so sorry for your loss. I'm so, like, my heart's crushed for you. But I also had so many people that had gone through that grieving process, and they said, I'm here for you. This is what I've done to help myself. This is what
Mhm.
I saw benefit me get out of that grief and be able to move forward. And so one thing that Kanan and I did, is we got into therapy because I didn't know how to navigate that grief. I didn't know, I didn't want to be a burden on somebody else's shoulder of somebody who was like, hey, I've been through that. And I didn't want to unload all of my grief onto them, because
Yeah.
that wasn't fair. And so Kanan only went a handful of times. I ended up going every other week for 6 months.
Wow.
And so that was a way for me to talk it out because I didn't know what I needed. And for some people, they were like, hey, what do you need? How can I help you? And I was at a loss. I didn't know what I
Yeah.
needed. And so that was one way when I felt like 5%, you know, it's one of those things where people are like, what count what blessings you have around you. And I'm eternally grateful for everything that I've been blessed with. But when you're at that 5%,
That's
you're
not
like,
helpful.
no, I think I'm going to go crawl in bed and like have a quick breakdown and like get back on the horse kind of deal. And so I found that going to therapy helped a lot with my mental health, helped a lot with the grieving process. And it helped me be able to get past those days where I'm at 5%, you know?
That's awesome. I'm glad that that was something that you took advantage of and
Yeah.
were able to kind of, because I think you're right. I think just being able to process with someone that isn't necessarily like that
They
you can
weren't
just
related.
unload.
Mm-hmm.
Yeah, like that's there to unload on.
Mm-hmm.
Um, but okay, so let's fast forward to just a little bit.
Okay.
Um, because you went through all this, and that is something that obviously is not easy.
Yeah.
When did you discuss with Kanan and your OB kind of the next steps on like when you wanted to get pregnant and what kind of like
Yeah. And what that was
what
going to look like.
yeah.
So 2 weeks post-op, I went back to my OB, like I said, and she said, moving forward, she looked at my health history and she was like, moving forward, how would you be comfortable if I put you on some fertility meds? It will help because I had an ovulation cycle 3 to 4 times a year. And that was due to scar tissue and just eggs not maturing enough and a whole bunch of other things. And she said this would up my chances of getting pregnant sooner if I was ready for that. And she didn't push this on me. She was just giving me options. But typically after what is most of the time, to my knowledge, happens is after you have a D&C, you're more likely to get pregnant quickly just because at that point, like they've cleaned out your uterus, everything looks really good, like they've made it like tip top shape for a fertile egg kind of deal.
Yeah.
And so she was like, if you're ready, talk to your husband, see what you guys want to do. You guys talk it over. And we can get you on. She wanted to put me on letrozole. So there's two options that she was talking about, Clomid or letrozole. I don't know the scientific details about the differences of them. All I know is Clomid is, I think, more intense than letrozole. And she was like, the fact that you do ovulate is a good sign. We just want it to happen more often to like increase your chances. And so I got put on letrozole 2 weeks after I was like, send in that prescription. Let's go for it. Hindsight looking back, I think I was still pretty numb when I made that decision. Not regretting that decision because then I was on letrozole for 9 months before. So actually, I was on letrozole for 7 months before I got pregnant again, and then I miscarried that baby. And then 2 months after that, I got pregnant a third time with my daughter now.
So how far along were you with the second pregnancy when you miscarried?
I think I was like 6 weeks.
Okay.
6 or 7 weeks. I hadn't even told Kanan I was pregnant.
Oh, wow.
I talked to my therapist about that too. And I think it was a lot of fear. It was
Sure.
a fear driven thing of like, okay, I have this, but I need to hold on to this and I need to keep it to myself to protect it and to protect myself. But I ended up losing it. And when it's that early on, I believe it's called a chemical pregnancy. And so it wasn't very traumatic to like go through that loss. I hadn't had a sonogram, hadn't had anything. I just had positive pregnancy tests, and that's it. And I told my OB, and she was like, "Yeah." She was like, "I think that was a chemical pregnancy. Those happen." And then I did some more digging on miscarriages, and it turns out 1 in 4 women will miscarry. And so I thought that was just wild to me because when it happened to me, I felt so alone because I didn't know anybody else.
Mm.
But then I realized it's because nobody talks about it. And I understand why, because you feel like you failed. Like you don't want to like, hey, here's where I messed up and advertise it to the world. And so since I had already gone public with a pregnancy and a loss, I
Right.
decided at that point there were so many people that had that I made a reel on Instagram, and it was my first baby sonograms, pictures we had, announcements we had done, like this whole montage of it. And it was on that baby's due date or due month. So it was in November.
Mm.
And it wasn't a post for me to like get, I'm not looking for likes, I'm not looking for comments. I wasn't doing any of that. It was a post to say basically like, I see you. I know you're there. I'm
Yeah.
1 in 4. Like there's 1 in 4 women that will miscarry. 1 in 100 have to get on some sort of fertility plan. And so I posted that and I put it out there of like, I'm here, because at that point I have felt healed. Like in my heart, I had felt healed. And so going on social media and saying, you know, I'm here for you. If you're at a loss, like call me at any point. I will be there for you. I know what you're going through. If you just need somebody to sit next to you, just to have somebody, like I will be that person, was basically what I was saying on social media. And I ended up having 2 colleagues at that time that had gone through miscarriages, and one of which called me, and she was like,
Wow.
I don't know what to do. What do I do? And I said, well, I can't tell you what to do, but this is what I did. And so I was able to help her through that because of those social media posts and because I had to be vulnerable and put it out there. So,
Yeah. Wow. Well, and at some point, you know, I want to get into on a different episode, maybe even with some other people, kind of your pregnancy with Precious Kenzie, and
yes.
kind of what that experience was like, after,
Yeah.
you know, 2 miscarriages, um, kind of what your
Yeah.
emotional state was and kind of how you guys went through that pregnancy together as a couple. But we'll get into that in a different episode. But thank you,
Yes.
Caitlin, for sharing and
Of
being
course.
willing to be open. And that's why we're doing this, is that people won't feel alone.
Mm-hmm.
So if you have any questions for Caitlin or anything that you would like to write in about, just put a comment, let us know on our Instagram, and we will get back to you. We'll write you back. But thank you, Caitlin. We appreciate
Yeah.
you being so
I'm
vulnerable.
looking forward to our next episode after this, because episode 3 is going to be your story and
Woo!
kind of your experiences of, you know, those social conversations that are hard to have, especially with loved ones. So
Yeah.
in a couple weeks, we'll have that one out and I'm excited for it. So tune into that one and we will see you then.
See you next time.